Right, welcome. My name is Sarah Sims, and I am the manager of continuing education for the Brown School here at Washington University in St. Louis. Thank you all for joining us today for our Open Classroom presentation. Open Classroom is one of the Brown School's professional development series. We invite you to explore our other continuing education programs at brownschool.wustl.edu under the Resources and Initiatives tab. Today's program is titled Learning from Early Career Investigators, Women's Empowerment, Child and Adolescent HIV, and Refugee Mental Health in Sub-Saharan Africa. Today's program is presented in partnership with the International Center for Child and Health Development, or ICHAD for short. And as you can probably tell, it is both virtual on Zoom, but it's also live and in person here at Washington University's campus in the Brown Lounge. For those of you who are joining through Zoom, we can't hear or see you, but we do want to engage with you in the chat. Please feel free to offer any comments or questions that you have for our panelists today, and we will be happy to moderate and share those at the end. We're also streaming live on YouTube. I'll put a link to the chat in that in just a moment. And so now I would like to welcome and introduce my colleague and facilitator for today's program, Dr. Fred Ssewamala. He is the founding director of the International Center for Child and Health Development. He is also the William E. Gordon Distinguished Professor, as well as the Associate Dean for Transdisciplinary Research, Faculty Research here at the Brown School. Dr. Ssewamala, please take it away.
Good afternoon, everyone. Thank you so much, Sarah, for that introduction. As Sarah has indicated, my name is Fred Ssewamala. I am the founding director for the International Center for Child Health and Development. That's the center which is hosting these events. But I'm also the associate dean here for transdisciplinary faculty research at the Brown School, and I'm on the faculty. So thank you so much for joining us. For those ones who are joining us, I don't know whether I should face here, maybe I'll look there. Thank you so much for joining us. For those ones who are joining us via Zoom, and for those ones who are in the room, also thank you so much for making the time to come in and really attend this event. So today's session is slightly different from what we normally do. Normally we have a speaker, they come in here, they share their work with us, and that's it, and then we ask questions. But today, what we are going to do is we are going to be hearing from our own trainees at ICHAD, our own trainees here at Washington University, and trainees within Brown School. These are postdocs, faculty members, and also graduate students who are finishing their PhDs. So I need to make a few announcements. Next week, and those announcements I think that either Laura or Chelsea or someone else will make, but next week we have another event which will be kind of showcasing our achieved trainees who have come all the way from two of them from Uganda and the other one from Sierra Leone, and they'll be joining us and sharing their work with us. So we look forward to hosting you next week as well. And then the other thing that I wanted also to highlight here is that next week's presentation will be the last for this semester, since we are getting to the end of the semester, which has been extremely productive. So in order to keep to time, I would like to introduce the presenters today. I think what I'll do, I don't know whether I should present one by one or I should read all of them. Maybe let me present one by one so that so that each of them at least feels heavy enough for the presentation they're about to make. So the first person who is going to present today for just 2 minutes, just telling us about, who they are, what has guided their work, and what has guided them to get to this stage is a student who is a PhD student in public health sciences, and that's Dr. Samuel Kizito, a medical doctor by training. Dr. Samuel Kizito is a research associate with our center, the International Center for Child Health and Development. Dr. Samuel comes originally from Uganda with a decade of experience in conducting research focused on designing and evaluating interventions to improve the outcomes of young people who are living with HIV, especially those in low-resource communities. Dr. Samuel, I've worked with him, but he's extremely strong in regards to research methodologies. He has done work around longitudinal cluster randomization. He has done work around structural equation modeling. He's very familiar with survivor analysis. He uses mixed methods in his analysis. And so he's extremely very, very, very strong. And so, and by the way, so that you know, next week he'll be taking his qualifying exams. So we're extremely excited about that. He also has expertise in social network analysis and agent-based modeling and spatial analysis. So please read about Dr. Samuel, and he's going to tell us more about how we got here. So Dr. Samuel, come and share with us.
Thank you very much, Dr. Fred, for your kind introduction, and good afternoon for those of you who are in St. Louis and in the US, and good evening, good morning, those of you who are joining us virtually from wherever you are. And my name again is Samuel Kizito, and I trained originally as a medical doctor. And my career path has actually been an interesting one because I started off as a clinician, and I did my master's training in clinical epidemiology and biostatistics. Both my medical training and master's training was at Makerere University. And I got a chance to do my clinical clerkship at Yale University School of Medicine. And then after my master's training, I had a one-year fellowship, Fogarty funded, through Yale University and in collaboration with Makerere University. So in 2020, I got linked up with Professor Ssewamala, and since then things have moved in the right direction. I've worked with Washington University in St. Louis, where I've done a one-year fellowship researcher resilience training, and right now I'm a PhD student. Actually, next week I'm completing my second year of the PhD. And my long-term career goals are to develop but also test out interventions specifically targeting adolescents living with HIV with an aim of improving their treatment outcomes. I've also been lucky to get some research funding along the way, my earliest of which came in 2011 when I was an undergraduate student, where I received a seed grant of $3,000 US. Since then, I've gone ahead to earn more funding, and in 2022 and 2023, working with ICHAD under the mentorship of Dr. Fred, we have actually put out a number of grants, many of which are still under review, including 2 R21s, which are an MPI, 2 R01s where I'm a co-I, and some internal funding. Fingers crossed, maybe they will get funded. Here I showcase a few of my first authorships where I use advanced research methodologies to test the effect of various interventions on adolescents who are living with HIV. I look forward to having a fruitful discussion.
Thank you. Coming back here, I guess. All right, so that was Dr. Samuel, and we'll hear more about his work in a few minutes. We are going to really have a great discussion. So the next person whom I'm going to introduce is Miss Josephine Nabayinda. Miss Josephine Nabayinda describes herself as a passionate advocate for women empowerment. She's currently also a second-year PhD student in social work here at the Brown School. She's also taking her qualifying exams next week in the doctoral. Yeah. So Miss Josephine comes to us from all the way from Makerere University in Uganda, where she earned her first degree. And then She went on to do a master's in the University of, I think it's called Agda in Norway. And then after that, she did some work in Rakai, in a place called Chibale, and then we got her to work with ICHAD in Uganda, where she coordinated a study, but also she worked on lots of different data analysis for us during that time. So she's interested in developing innovative applied interventions, in promoting economic empowerment interventions, and also in helping countless, she says, countless of young women who are very vulnerable. So Ms. Josephine, come and share with us where you are right now.
Yeah, thank you so much, Professor Ssewamala, for such a kind introduction. My name once again, Josephine Nabayinda, and I'm currently in my second year. And my research focuses the barriers and facilitators to economic empowerment of young women in low-resource communities. And like my fellows, I'll just give a brief about my education and research career. In 2021, that's when I completed my bachelor's at Makerere University, and my passion for women empowerment has been since my childhood. And I started with a research project that was really among 20 women in Rakai, where I interviewed women on their access to reproductive health services, and my measurement of empowerment here was their decisions in taking up these reproductive health services in Kaliso Hospital, which is a kind of a referral hospital in Rakai. And then in 2014, like Professor Ssewamala said, I moved on to do my Master of Science in Development Management in Norway at University of Agder in Kristiansand. And then I kind of had a twist on how I viewed the work of women. And then I wanted to look, working with Stormy Foundation in Norway, I wanted to look at the role of microfinance in promoting women empowerment, but specifically, how does this change gender roles as perceived from a patriarchy community? So my results were really fascinating. My thesis is online, so you can read more about that. And then from there, I worked with women in Rakai district, and I helped many of them who are kind of accessing small loans in one of the organizations in Rakai district. And my role was advising and trying to mentor these women to see how they can best make use of these loans. And in my journey, in Rakai, that is when I was connected again, Professor Fred Ssewamala at ICHAD through a colleague of mine, Dr. William Biansi, who is at Boston College. And then when I met Professor Fred, I think things turned around for me. And I got accepted into a Ph.D. program here at Washington University in St. Louis, where things have really been good. And apparently, I'm doing my Ph.D. and like Professor Fred said, I will be completing my qualifying exam next week. But during my time with Professor Fred, I worked as a study coordinator in the field. And also I got a chance to be enrolled as under the Research Resilience Training Program, which I completed this year. So I gave in my progress report. And also I was fortunate to be taken on as a managing editor for the Global Social Welfare Journal. You can look up for it. We accept manuscripts and we really do a thorough review for our publication process. And here I showcase some of my first authored publications. And like you see, one of my first paper is about the role of asset ownership in influencing sexual risk-taking behaviors among women engaged in sex work. This is a project that I've worked on under the guidance of Professor Fred and a few of us, like you see. Thank you very much, and I look forward to discussing more about my work during this session.
All right, and the last person, last but not least, in terms of introduction, is Dr. Nhial Tutlam. Dr. Nhial is a colleague of ours. He came to us as as kind of a postdoc, and then he's now an assistant professor, a research assistant professor here at the Brown School, and also a Fogarty Global Health or Launch Fellow within one of our training programs called Achieve, which is funded by NIH. Dr. Nhial's research centers on mental health and its impact. How young people have been impacted by war, and then how that creates issues of trauma and issues of poor mental health functioning. He works, not exclusively, but he works in refugee camps, but he also works with refugees who are residing in urban and rural areas who are not in camps. He's currently leading several projects which are funded by NIH here at Washington University, by the Grand Challenges Canada, funded by Centene, also through a COVID-19 grant here, and several other studies. Before coming back to academia, he worked for St. Louis County as the chronic diseases epidemiology manager. And in that role, of course, he was at the forefront of overseeing chronic disease surveillance and establishing a mental health surveillance system with several millions and millions of dollars under his decade as the manager. He's very multidisciplinary, trained as a public health person, but engages with all kinds of disciplines. So Dr. Nhial, who is originally from Southern Sudan, is going to share with us briefly, and then we'll after that, we'll launch into a discussion. Dr. Nhial.
Thank you very much, Dr. Fred, for the kind introduction. So as Dr. Fred said, my research focuses on the mental health of young people who have been affected by conflict, and my work spans the continuum of people who are in the refugee camps, as well as people who are resettled in the United States. For those in the United States, particularly focusing on this concept of intergenerational transmission of trauma, because there's evidence that young people who have not experienced war themselves can actually be impacted by the trauma of their parents. So how I got to where I am. So I have a very interesting story, and I'm the old guy of the group here. I started at WashU a long time ago as a research assistant in the Division of Infectious Diseases, because when I was growing up, cholera was a big problem in the refugee camps and all that. So I thought, I'd get training, go back in the refugee camps, work in some of these places to prevent cholera at the population level and things like that. So I was in ID at the medical school. And then through some luck or some opportunities that came up, I ended up in a neurology department where I worked on multiple sclerosis research, doing a lot of cutting edge work, examining people with multiple sclerosis using diffusion tensor imaging at the medical school. And then, I wanted to focus on the work that really is near and dear to my heart. So I decided to go back to school to pursue my Ph.D. so that I could then, ask questions that I'm interested in, questions that I'm addressing right now through my research. And so I went and got my Ph.D. from SLU. And then before I completed that, I ended up getting a position at St. Louis County Department of Public Health, as Dr. Fred mentioned earlier on, where I oversaw the chronic disease epidemiology program. And serve really as a point person giving advice to the department leadership in terms of methods, in terms of data analysis and all that. And then so I came back to academia. So I joined ICHAD through the LEAD program. It was summer LEAD program. I think it was a 2-month program that I started with after I met with Dr. Fred. And I explained to him I wanted to come back to academia. So I keep telling him I loved it so much. I came back for another dose of LEAD training program, stayed the whole year as a postdoc. And then, wrote grants and was fortunate to get funded and transitioned to a research faculty position, and also became a Fogarty fellow, global health fellow. And so that's where I am. And in terms of my long-term goals is really because as I mentioned, I work with refugee young people. And so my goal is to try to develop and test these interventions that are aimed at addressing these mental health conditions among young people, both here in the United States and those who are in the refugee camps. And here I highlight, some of the projects that I have going on right now. Some of them are funded. So one of the projects I have here is a K that is pending. So hopefully that notice of award will come in the next few days or so. And so this will allow me to develop interventions to address mental health among young people who are residing in the United States. So these are kids who did not experience the war themselves, but through their parental trauma. So that's something I'm very excited about. It's going to be about the next 4 years of my life. But I also have these other projects. So there's a supplement that we received from the NIH, where we are working in the northern part of Uganda in the refugee camps with young people who have HIV, and we are trying to look at issues of adherence to their treatment, viral load suppression, and also, as you know, these are refugees who came from very traumatic backgrounds. So we're also looking at their mental health outcomes as well in that. And then I also have funding from Grand Challenges Canada. This is based in South Sudan, where we are trying to adapt an intervention called Youth Readiness Intervention that was developed for really former child soldiers in Sierra Leone, which is also, this is a population that, similar to what we have in South Sudan. And so we're doing that. And then we have a COVID-19 grant that we are going to compare young people who are in the camps, how COVID-19 has impacted their mental health, and young people who live in urban centers, particularly a town called Arua and Bidibidi, which is the second largest refugee settlement on the continent. And so we are going to look at those as well. And then we have some other grants, additional grants as well, looking at these interventions of how we can improve mental health outcomes among young people. And here I highlight some of my publications from my dissertation work and some of the work looking at how mental health has impacted refugees from South Sudan in the different settings in South Sudan and in the camps and in those who are resettled in high-income countries. And some of the work that I've been able to do since I've joined ICHAD, looking at the mental health outcomes among children who have been orphaned by HIV. And I look forward to more discussion. Thank you.
All right. Thank you so much. Thank you so much. Now we move to this the section where we are going to be discussing for the next at least 30 minutes. Let's discuss. But also, when I ask a question, I think the best way to do it is, I don't want to dominate. There is a reason you are all here, and I see, there might not be lunch. There may be lunch, I don't know, but you are foregoing your lunch so that you can learn something. So if someone answers and there is a follow-up question, please go ahead and ask, than waiting to the end, because we want this to be very, very, very interactive. The first question I'm going to ask, and I'm going to ask Josephine here. Miss Josephine, could you tell us, I was given some questions, so I need to make sure that I stick to the questions I was given by Laura. Could you please tell us more about what inspired you to pursue the exact research that you do? Don't tell people that it's because that's what Fred does, that's why I'm doing it, but what really inspired you to do what you do?
Thank you so much. Thank you so much, Professor Ssewamala, for that question. 25 years ago, my dad was hospitalized due to mental illness, and my mother had to take care of us at a very young age. And in my view, I thought, like, if this woman only had resources to actually take us through this life, maybe he wouldn't have to go through that hard situation, to go on dig or like labor in people's gardens to raise income, because this mental illness took over 10 years. So I'm imagining 10 years of my mother having to struggle to raise us, to pay for our school fees, to make sure that we have something to eat. And as I grew up, I was like, I wish my mother didn't have to give birth to all of us, because we're quite many. Maybe if she only gave birth to maybe a few of us, like 2 or 3, that would really have helped, so that she could have fewer children to kind of like, to whom maybe she would have supported. And when I reached my university, my first degree, then I was like, okay, maybe let me see why it is really important for women to take decisions for sexual reproductive health services. Perhaps if my mother had a choice to take the decision on how many kids to give birth to, this would have helped her not to struggle a lot to raise 6 children and other 3 children, like to enable us get education. But this wasn't the case because it was my dad to decide. And this really influenced my other decision to pursue my master's. And I was like, okay, if women are given access to credit, can they really take charge of the decisions they make? And can they actually engage in roles that were predetermined by society as men as walls? So this together with how I grew up seeing my mother kind of drove my decision to engage in research that really focuses on addressing the economic well-being of women. Because I believe, like my mother, many women out there are struggling. Many women out there do have to go extra miles to engage in things that they wouldn't have supposed to. For example, a project that I've been working on under Professor Ssewamala, women engaged in sex work. Most of these women have raised poverty as the most leading factor for them to engage in sex work. Perhaps if there was an alternative for them not to engage in sex work, this wouldn't have happened. So that drives my passion to engage in research interventions that really aim at addressing the economic well-being of women right from my childhood to date.
All right, great. Thank you so much for giving us that perspective and how, frankly, lived experiences have really guided your research agenda. And just in a few minutes, just as a follow-up, some people would argue, because lived experiences guide my work, but some people will argue that there should be a difference between research and advocacy, and that when people are using lived experiences, they tend to create questions which are very biased. And so what do you say about that? Just in a few seconds.
I think to me,
in other words, how do you bring in rigor to make sure that it's not because of the emotions that are guiding your science?
Because I believe that lived experiences are the best solutions to intervene. If you hear people's voices, that is when you actually get the right intervention to really guide how you can address this problem. To me, it's not about biases. To me, it's about listening to the voice of this person, because the best way to address the problem is by listening to the people who are actually facing the problem. I believe it's not biased.
Okay, so Dr. Samuel, I want to give you the same question. You started as a medical doctor, and in Uganda, there are not many people who start as medical doctors. Really, it's way up there. So what inspired you to get where you are, to pursue the research you are pursuing? Even, you could be in a clinic treating people.
Thank you so much for that question, and I'm glad you asked it. Not many people actually ask it. When I give my career path, I always highlight my year of internship, and this is for a reason. I did my internship from Mulago Hospital, and those of you who are not familiar with Mulago, it's the National Referral Hospital in Uganda, and it's a high patient volume hospital. And during my year of internship, I spent a lot of time on the infectious disease ward. This is a ward which is 70 to 80% HIV patients at any given time. There are two stories which actually changed my perspective. Training as an undergrad, my target was to maybe do a clinical master's, then become a cardiologist or a kidney specialist. But during my year of internship, I received a young man who was from Katanga. Katanga is a slum just next to the hospital, came in with his wife and a young baby who was 1 year old. And he kept getting this fever, what we call fever of unknown origin, kept getting fevers. But because it's the police on that ward that we test everyone for HIV, actually when we tested him, he tested positive for HIV. He was a well-built man. And I had to break the news to him. And seeing his face and how he responded to the news broke my heart. because this is a man who you could tell that his dreams had been shattered. And he didn't take the news so well. Unfortunately, in the next 2 to 3 weeks, he progressed so fast and he didn't make it. Then, along the way of my internship, there was this bad night on my same ward that I left my ward when it was okay, everyone was stable. Then when I returned the next morning, I had lost almost 1/3 of the ward. These were young men and women. They were dying from HIV. So I sat back and I was like, wait, coming here to treat when people are already advanced, I want to do as much impact as I should do. Maybe I need to step back, look more at preventing them from coming in very late. And it was during my year of internship that I actually decided to enroll for my master's, which wasn't a clinical master's, which was a master's in epidemiology, which is a discipline which can give me enough research rigor to be able to conduct research to address some of these bottlenecks. And during my master's, I actually noticed that still that wasn't enough. And when you look at my career path, I kept going broader and broader in terms of the socio-ecological ladder, that eventually I did another fellowship. And one of the reasons why WashU resonated a lot with me is because I got a chance to even look at the social determinants of health, given that this school not only teaches you the public health schools alone, but also it is stewarded with the social work school. I have now a broader look at those determinants of outcomes of HIV infected and HIV affected adolescents. So it's more of a lived experience, but as a clinician.
Okay. So thank you so much. Thank you so much. And I'm assuming that if I posed the same question, how does that, passion, how do you impact the way you ask questions without biasing you?
The good thing is that throughout my path, I've worked with teams of researchers who are strong in terms of research rigor. So when I pose my questions, one, I'm kept in check by the colleagues that I work with on my research teams. So oftentimes I ask questions which I feel are the best, and then I'm guided, this needs to change here and there. But also over time, I've come to appreciate the role of theory in research. So my earlier work wasn't grounded in theory, but my late work is grounded in theory, and that theory informs the questions I ask and how I approach my responses.
All right. So Dr. Nhial, I know your lived experience definitely has guided the kinds of questions that you ask. So if you could combine your lived experience and coming to WashU, how are those kind of married together or being brought together to influence what you do?
Wonderful. Thank you very much for the really great question. So as Dr. Sam said, really, this is our lived experience, but guided by theory and guided by research methods. And so we are not just saying, oh, I have PTSD because I lived in this refugee camp because I went through war, and therefore I'm going to be asking these questions. The question is, how do you take the passion that you drive from that lived experience? Because I tell people when I ask questions, when I do research, I have those people in the back of my mind, but then I bring my training in epidemiology and public and say, how can we then ask these questions? And how can we address these questions? And so bringing those strong public health background and training to ask these real world questions to come up with some solutions to address these problems is how I look at that and how I approach those.
Okay, so how did you get there? How did you get where you are?
So how I got to where I am. So as I mentioned earlier on, I said I needed to ask questions that I was very interested in. And so what I realized that my master's degree wasn't enough to be able to ask those questions, because I often worked as a research coordinator, answering questions that somebody else had, right? But then I went to get my PhD to get that training to be able to address these questions. And then I came to WashU and found this infrastructure that exists through ICHAD, where I can then, I can actually go to the refugee camps and try to address these problems or these questions at the root of them. Or I can write these NIH grants through this infrastructure that has been put in place to be able to address these problems. And so I really, the infrastructure that exists, that passion that I have through my lived experience and the opportunities to be able to actually engage with different people, different individuals who are experts in this field to also help guide me or partner with them, collaborate with these individuals to address these problems.
Okay, excellent. So you talked about the infrastructure. Ms. Josephine, I'm going to pose the same question to you. How has studying at WashU, how different is it than studying in Norway? Why didn't you go back to Norway? And how has studying here changed you, either for the good or for the worse? Or, could you tell us about your experience studying at WashU, given the area that you're interested in?
Thank you so much. First of all, it was the network of people that I met along the way, especially you, because after reading about everything that you had done, and I saw that your earlier or even your current work deals so much with women and in your research communities. So to me, this was one of the things that inspired me to move along with someone who can understand my dream, who can support my vision. Sorry. So can I repeat? So one of the things that inspired me to move to WashU, not actually go back to Norway, was the fact that I met a network of people that would give me a conducive environment to continue pursuing my goal. And one of those network was Professor Fred. Having read about the work that you do, especially among women in low resource communities, was one of the things that really sparked me, because the work that we do really needs people that understand our vision, who can really back up the vision that and the dreams that we want to fulfill. So, and also the network of people that are really experienced in your field. So when I read about the faculty at WashU, and definitely when I had someone who would really mentor me deeply in my area, it was one of the things that made me to take a decision to come to WashU. And I do not regret it, because most of the information that I've learned here, it has really been beneficial to me to help me improve and see things differently than I used to when I was still maybe during my master's, or even when I hadn't reached here at WashU.
Okay, thank you. So Dr. Samuel, I know that you mentioned having studied at Makerere, having done a certificate at Yale, but I also looked at your bio, and you have done work with Boston College, Boston University, you have done work with NIH. What is it that WashU has given you different? How has it changed your training, having gone through these very peer institutions, very strong institutions? How different is it?
Thank you so much, Dr. Fred. I will say WashU is unique. And I already mentioned one of the unique features of WashU, especially the Brown School. I actually applied to 9 universities for my PhD. 5 of them gave me admission, but I didn't think twice before accepting WashU. One, the Brown School, as someone who is studying public health, I take some of my courses in the medical school. I take other courses in the public health. And then I have this close networking with the social works. So that gives me a very broad and interdisciplinary ability to see problems, not in one dimension as a clinician or as an epidemiologist, but also in a social works lens. And it was not until I got to do work with established social workers and researchers that I came to appreciate the role that social determinants of health have to play in terms of influencing disease outcomes. And I always give this example. As a clinician, when you're seated in your room and you just prescribe medicine and tell someone, go take this medicine after a heavy meal, yet someone can't even afford a single meal a day. So WashU has given me that broader perspective. Secondly, the top faculty at WashU, and I won't pick names, but knowing people like Professor Ssewamala, Dr. Ross Brownson, Ross Hammond, Dr. Luke Dag, who are top 1% in their fields, surely you get that top experience. One more unique feature that I will mention, which I've seen at WashU, is the support in terms of infrastructure from the school, but also from ICHAD. I'm a second-year PhD student, but I've been part of grant applications to NIH 5+ as a second-year student, and I have over 50 peer-reviewed publications. That kind of support, I'm very sure I wouldn't have got it from anywhere else.
Thank you so much. That's a great, that's a great assessment of what we try to do. I'm glad that it's really done right. Now, Dr. Nhial, you have told us for you your history of course, coming from Southern Sudan, then doing the master's, and then feeling that let me do a PhD, working for the county department. So tell us about what are your long-term career goals and personal goals, and what so what else is there to reach?
I feel like I'm just getting started. So this is it's not done yet. So as I said, I have this hopefully pending K that is coming hopefully soon. So that will help me build on my dissertation work, looking at this intergeneration transmission of trauma among the refugee population. But my long-term goal is really to become a recognized expert in developing and testing interventions, community-based interventions in particular, to address a lot of the mental health issues that are affecting conflict-affected people. For us, it's not a question of whether the literature is there. We know that people who have gone through war trauma are affected. PTSD prevalence is somewhere anywhere from about 50 to about 90%. So we know the statistics. We know that these individuals are affected. We also know that there's building evidence that even the next generation is affected. The question for us is, and I think this is the infrastructure or the opportunities that WashU, ICHAD has afforded me, is how do we address these problems? And so then developing this theory-guided interventions to really hone in and develop these interventions that can be applied here and can also be applied there. The other thing that also ultimately we want to do is, so we know we do a lot of work in Sub-Saharan Africa, and we do work here. Is there also an opportunity for us to do this bi-directional learning, where we're bringing knowledge from the global South and doing the work here? I have worked in North St. Louis County schools, and those schools, in terms of resources, are not different from the high school I went to in Nairobi, Kenya, right? And so what are the kinds of things we can do? I remember going to a school in North St. Louis County where, they were very excited to show me that they had just installed new washing machines. And my question was, why do you need washing machines in school? But then they said there are kids who can't afford to wash their clothes at home, and therefore they bring them to the school, have the school staff wash them so that the kids actually don't miss school because they don't have clean clothes. And so there are these issues. Can we really bring some of that knowledge we have in Uganda to address some of these problems locally? And I'm glad WashU also has this perspective of being local and also being global. And so some of those things, I think I really want to find my lane in that and contribute to that.
Excellent. Thank you so much. And I'm glad, yes, WashU is now, is not simply doing work here, but it's part of the community here. So, Ms. Josephine Nabayinda, so you are doing your qualifying exams next week. You are, you'll soon go on the job market. So could you tell us, if someone asks you, what are your long-term goals? What next? What do you envision 5 years from now, or even 10 years from now?
Yeah, thank you so much for that question. I envision myself as an independent researcher who is going to focus so much on interventions that would help address the barriers to women empowerment. I understand that, like Dr. Nhial mentioned, a lot has been written on what really hinders women to achieve women empowerment or achieve their empowerment. But still, we see that women are still the poorest of the poor in the world. Women are still struggling with achieving education. Women are still lagging behind in almost all levels of their life. So I really want to see myself through implementing interventions that address those barriers that we haven't really looked into, the gaps in research that are really hindering women to become the best of what they're trying to do. And my focus is really on those women that have been left out in low-resource communities.
Thank you so much. Dr. Samuel, I will ask you a similar question in regards to, not more so of your research, where you see your research going, but how would you advise a young professional who is interested, young medical doctor, young public health person who is interested in research, and they are very early in their career? How should they start out?
I'll mention 3 points. 1, they need to be driven by passion and not by maybe the need for money or recognition, but their passion, and this passion can come from either their lived experience or whatever it is. 2, they need to seek out for mentorship. Research is not an area which you maneuver by your own, surely. You need mentors, and mentors who are willing but also available to mentor you. And then the other piece of advice would be to be humble and hardworking. It's not enough to be bright. You need to be bright, but also have the humility to be teachable, and you work hard because there is also that extra component.
Thank you so much. I think I want to, in the next about 12, 13 minutes, I want to open it up to the audience, both online and here, to ask questions. I still have many questions if you don't want to ask, but I really wanted to make sure that this is very interactive. This is exciting to me.
So good afternoon again. Thank you very much for the insightful information. I think the last question Dr. Fred asked is quite similar to what I wanted to ask initially. So my name is Mamadou, I'm from Sierra Leone, and I'm a medical doctor by background and part of the ICHAD training program. And I'm looking forward to going to research fully. My question, like I said, is quite similar to what Dr. Fred said, but it could go for anyone, is as an early career person or somebody trying to go into the field of research and coming to an end of the Achieve program, what would be the best advice you would give someone like me to successfully complete a research career path or an early career research path, like going into a PhD and be successful? We've had stories of people dropping out from programs and all of that. So what would be your best advice? And I think it's for all of you or anyone. Thank you.
So let me build on some of the that Dr. Sam talked about earlier. So passion is really key. And what does that translate to when we talk about, I don't know what time Dr. Fred sleeps. Okay. This morning, given just talking from my own personal experience, at 3 in the morning, I was in a meeting with a group in South Sudan that is helping us to do a research project. Now, you don't wake up at 3 in the morning if you don't, don't have that passion. So, and the other thing is to be also prepared to put in the work. This thing is not just going to happen by itself. Most of us have had sleepless nights sleeping on couches when you're working on those R21s and R01s. And so that's so, and passion helps you do that. Having a goal in mind in terms of what is it that I am trying to solve. So because there are lots of problems. So for me, I in this area that I work, I look around and there's nobody doing it. right? And so then it's up to, I mean, I feel it's my responsibility. I have some skills to contribute to the general welfare of this population that I care about. And so it's a question of how do I utilize these skills to help these individuals who are going through a lot of these problems that nobody is paying attention to at the moment. And so you have to be able to find that the reason why you are doing that, that passion, and then finding your sort of your lane, your niche, and trying to figure out how to fit in there.
So maybe just to add to that, Dr. Muhammad Wandai and Dr. Samuel and Dr. Anita, work closely together. And they know that we have written proposals that have been rejected, meaning that they have not been reviewed, or they have been reviewed and given a bad score. So when you look at my CV or you look at Samuel's CV, the problem with CVs is that we never list the failures. We list the successes. And when you look at it, you're like, wow, this person has made it. But you don't know that probably by the time I produced that, 80% of whatever I was submitting was really being rejected. And so Dr. Mamadou is now really learning that, saying, oh, it doesn't, and really we spend a lot of time. And I think it goes back to the passion piece, that if you believe in an idea and you really strongly believe that good science and good, it's guided by good science, and that it's a productive question, I think you keep to it. I always tell my team that a grant written should always find a home. A paper written should always find a home. So it's that I think people who don't make it, in my case, at least people I've seen, are people who give up on first try or second try. They say, you know what, this is not meant for me. Well, how will you know that it's not meant for you if you don't keep trying? So I think it goes back to that. But I just wanted to add, giving you an example and knowing that, you are with us in this, and that sometimes it's like, we spent a lot of time on this, but, the reviewer didn't find it, maybe something, but anyway, so that's what I would add on to that. I don't know whether someone wants to add or want to take another question.
We have one question. It's kind of a follow-up, so we'll go to that, and then we'll go to you, Dr. Joyce. From Dr. Olum on chat, it's a question for Dr. Nhial. He's curious about your experience transitioning from public service in the department at the St. Louis County Department of Public Health to kind of hitting the ground running in academia. He would love to hear more about that.
Thank you, Dr. Olum, for that question. So yeah, for me, again, so a lot of this also involves passion around having questions that you really want to answer, and having the training and being prepared to really put in the work. Dr. Fred knows this. The grants don't write themselves. You have to write them, and that sometimes means sleeping on the couch 2 nights, 3 nights before the grants are due. And really for me, what drove me was the passion and feeling like, so I have this infrastructure, I have the opportunity to really be able to succeed in this place. And because before that, I wrote grants for the county department of public health. Those went in. I think we were doing some really great work. But these now are my questions that I'm interested in, that I want to answer. And then they are written, and I have the infrastructure right there in front of me. So for me, it was not letting any opportunity go to waste. So if any grant that comes along, we will write it and we will submit it. It's up to the reviewer to say yes or no. Some have, luckily, we've succeeded in some of them not so much. I think the first submission was not even discussed, and then the second one was not discussed, the third one was not discussed. But then you come back, and then once you get that first one, the taste of success, and then it feeds on itself as well. And so now you become what my grandmother would say, greedy, and try and trying to get more and more until now you have no time in your day to do this work. So that's what has really helped me move forward. Thank you.
Okay, Dr. Joyce.
Thank you so much. This is really wonderful and learning experience for some of us who want to fall in your footsteps in terms of becoming independent researchers. And mine is still a follow-up on what you are saying in terms of how do you balance it up. I know sometimes we are really motivated to do things, and from what you're saying that, oh, not all of them are actually going to be funded and all that, but beyond the career, beyond the writing, beyond the rejections, what are some of those tips that you actually use that really going to keep you going? Because sometimes you can do something and at one point you actually feel like you are breaking down. But what gets you up again and say, oh, what are some of those hobbies that, some of us could actually borrow and say, oh, if I do this, maybe in 1 week or 2, I should be able to get back on that computer. What is that motivation? Thank you.
Yeah, and even you were an editor of papers, so I'm sure that you get rejections. But go ahead, Dr. Sam.
All right. Thank you so much for that question, Dr. Joyce. And I think this resonates a lot with me because being a PhD student who has been taking courseworks and writing grants and manuscripts and everything, sure, I've had quite a busy schedule. And one of the things that I've liked, especially with ICHAD, is although we write these grants, but we write them in a short time. So you don't spend long months while working on the same thing to be there to bother you for long. And I think we wrote one in 2 weeks or something. But then the other thing is I treasure family a lot and I always fall back to family. Actually, everyone who I work with knows that there are some hours where I don't like respond to mails until maybe later in the morning or something, because family is my source of like rejuvenation. And when it's actually like summer periods or stuff like that, I really cut down on the work that I do so that I spare time to go play my tennis and everything like that. So I treasure family, I treasure free time. And when it's time to work, it's time to work.
Yeah, I think Samuel has just borrowed what I was going to say, but like being a mother, and actually a long distance mother, because I left my kids back in Uganda. So it's been challenging on my side, but I feel like each time I call back home and my daughter says, "Mommy, what are you doing?" I'm like, okay, I think I should be doing something at this time. So it has given me the confidence and commitment, because also me like doing my qualifying exam in 2 years, it's like I need to get this out of the way if I need to see my kids soon. So that love and like that passion with my family, but also the commitment, like once I'm committed to something, I should get it out of the way, whether unless when I'm just sick, but once I'm committed to do something, I should get it done there and then. I think it works with commitment, and then the network of people around you that support you and each day like make you like re-energizes you. I think it really helps a lot.
Thank you. So we have 1 minute, which I think Chalala should have a question. Oh, has answered it. All right. So Laura, is there a question in the chat that we must answer?
We have a couple, but we are at time. Is it okay if we do it real quick, lightning speed? Okay.
Yeah.
April was wondering what you see roles, the roles of, let me just not paraphrase here. Sorry, I scrolled away from it. Okay, what do you, the panelists, believe is the role for researchers and clinicians in advocacy and communicating findings to inform policy and future program development?
I think one of you wants to take that, especially someone who works in the county.
Yes, and we had this. This is a great question. We had this discussion in this very room a couple of weeks ago, talking about engaging policymakers. We are terrible at communicating we communicate amongst ourselves a lot, but really tailoring that language or our findings to the different policymakers in a language that they can understand. that way, then they can also, then they will be also be able to design and implement those policies. And so let's not shy away from engaging policymakers. I think they're human beings like us, and they can move things with just a swipe of a pen. And so really tailoring the information to be able to communicate to them, and making sure that that information is important and resonates with them so that they can implement policies that way.
All right, thank you so much. So I think we should bring this to a close. I don't know whether Dr. Pross wants to say a word as one of the co-directors and bring this to a close, okay? But once, thank you so much. So I think hopefully this was extremely informative than simply going through PowerPoints and talking about the chi-square this and F test this.
Thank you so much, Dr. Fred, and thank you to the panelists for sharing your experiences and how you've done it. In my eyes, you've made it. So in Luganda, we say, "Temucha sabirwa." So you're there. And that's my question. So I was going to ask a question to you all and say, since you are here, what are some of the things you're doing to support those who want to be where you are today? Because we don't want to break the chain. We want this to continue. So what are some of the things you're doing? But you don't have to answer now because we have to close. But thank you so much.
Maybe 5 seconds each.
Collaborating with the people, the next group, with your colleagues, and making sure you're working on either it's grants, it's papers, it's ideas, discussing those ideas, and sharing your story with them, how you got here. I think that's helpful.
Sharing the story and sharing the information that they need to make it.
Paying tuition for some. I like training a lot, and I like mentoring my colleagues.
Yeah, so and they always know that I always tell them that if I hear people asking for help from you and you're not giving it, I'll be mad at you. So because I think that we all have to give because we have all received from others. But so Laura, back to you. Thank you so much. Guys, great panel. Thank you so much.
I think Sarah's going to close us out.
Really quickly, thank you all to the presenters and those in the audience, virtual and online, for the excellent engagement and questions. Congratulations to all of you on your research and your work. Quick reminder that you can view a recording of today's program if you want to watch it again or share it with a colleague on our website or our YouTube channel, which I